God forbid you get sick with those things that you were supposed to stop and you didn't stop, you can look back and say, had I done this? And we don't want that to happen to you. So for today, we are going to basically go through some of the things that we can do right now, here and now, some stuff that we can take care of in order to stop ourselves from getting into sex diseases as serious but as common as we see happening all around. The first question that we have is, why should we be screening? And I would start off with that.
Yeah, so early detection improves better outcome. So if you do your screening and they find something at the early stage, definitely the outcome is going to be better off than to wait till the latter part of the disease state to be diagnosed. That's when it becomes more difficult for doctors to, really help out. And most of the time, the outcome is not favorable. So early diagnosis really help good outcome with treatment.
Early diagnosis. If you know, there is a saying that if you know, you know, right? But how would you know if you don't screen? So the key is to screen. Get yourself checked. Screening basically means be active in the role of checking stuff on your body. If you screen and something is found, especially when it's found early, you can get rid of it and live on with your life. That's the whole point of screening, because you don't just want to find something. You want to find and get it down or get it out so that you live your life, right? So that is the first thing. The second thing is evidence-based. The studies show that when you do screening and you find something, you are most likely going to survive. It's proven that people who screen or people who are always screened are more likely going to have their issues taken care of. They live longer because obviously they screened and they found certain things and took care of it, compared to somebody who does not have any screening done, no matter what kind of disease. So for these diseases, we're going to be talking about early screening. The research supports as evidence that you live longer, you have cures more than somebody who doesn't screen.
Yeah, and also regular screening always also give you a peace of mind.
Gives you a peace of mind.
Yeah, because like if people are worried about certain things out there and you keep hearing people are getting prostate cancer, people are getting heart attack, people are getting diabetes here and there, you are not going to have a peace of mind if you don't know.
You don't know your state, right?
But if you are screened, when you hear stuff like that, you are not worried, because you know your numbers. And as such, you have your peace of mind.
Definitely. You have your peace of mind if you screen. If you don't screen, then you don't have your peace of mind, right? That is exactly what it is that we have to talk about. All right, so let's begin. The first common cancer that we need people to be screening for is what we call the colon or colorectal cancer. And who needs the screening? We'll start off with that.
Yes, so if you are 45, then you qualify to get a colonoscopy.
Yes.
So you have to be 45 to begin screening. So normally when you go to your doctors, they will request that you make an appointment with a clinic and you go get your colonoscopy done.
Yeah, and that's starting from age 45, right? It used to be 50, but now they found out that younger people are getting colonoscopy so bad that they needed to decrease the age at which we get your first colonoscopy. Now, that being said, if you have any chronic colon issues, you may even be 30 or 20 and they will order colonoscopy for you.
Yeah.
But apart from that, for regular colorectal cancer screening to prevent and to nip it in the bud, what they will do is by age 45, especially if you are of black race, or a minority group that is more affected, then by age 45, you will be required to get colonoscopy done. That is what it is. And then from that point going, I think what you do is every 10 years, if it's normal, then every 10 years you go for a follow-up colonoscopy. So not to say follow-up, it's just you repeat a test in 10 years. But if it is abnormal, what do?
You have to listen to what your doctor have to say, because sometimes if it's abnormal, they may ask you to come back in 6 months or in a year just to monitor you. And sometimes too, when they're doing the colonoscopy, they get to take out the polyps, right, in your colon as they go down your colon. So after they've done it all, maybe they may take a biopsy, or maybe they will do certain things to make sure that you are safe. So if it's suggested, your doctor recommend that you come back after a year, because they really want to pay attention to the details, right? From what they have seen, it's something that you don't want to ignore. You have to follow through with what they're saying. If you are not sure of what they're saying, or you don't trust the results, you can always have it done at another location just to confirm what they're saying. So if it's confirmed, or you trust what they've done, then you have to follow up. You have to make the appointment. I'm sure they'll be calling you, and when they call, don't ignore, just follow through. And as long as you are monitored closely, you are going to be okay. Because if you start at the age of 45, it's likely that there is early detection, if there is anything at all. And if they are able to get to it as soon as they find something, and you are also consistent in following through, there is no way that is going to lead to cancer. Or even if there is cancer, they are able to attack it right away before it spread throughout your body.
Definitely. And the good thing about colonoscopy, which also incidentally is a gold standard of care, because there are other tests for this. I think we are actually ahead of ourselves. But basically, when they find something like the polyps, which can develop into cancers, they can take it out. So they are doing a screening, but they can also fix stuff as they go. And I mean, I know you said that if you are not sure, you can go to another place. But colonoscopy is
colonoscopy.
It's a camera. They're using cameras to see. So if they actually did, you are actually better off, following through what. Yeah, it's not like something that they are making their own judgment. Sure. If a camera has picked up, the worst thing is to not see it and then go 10 years later, But if they actually see it, I think you should definitely listen to them. Of course, you can always get a second opinion, but I think don't waste your time on that. Just get it taken care of. And of course, they would have also taken it out. But then, as she said, you're monitoring. Yeah, you got to go back earlier than 10 years. Depending on the practice, it may be 10 years. 1 year. 1 year. It may even be 6 months. If they feel like it's too aggressive there, they may have you come back 1 year, 2 years, 3 years. And it's okay. I don't say that. Why is it that everybody is going 10 years? My doctor wants my money. I'm not.
You want to make money out of me.
Yeah, that's not the reason. So that is something that we need to take care of, so that we will not basically do anything that is not right for us. So let's go to the next one. We talk about some of the tests that are actually done. The tests that are actually done. And for me, I think, I don't know if I can get yes. So my screen is saying it right. So we're going on to the gold standard, which I mentioned earlier, which is colonoscopy. So if you are in the US, most likely, if you are of age 40, 45, 50, and your doctor hasn't, just asked them, but if they asked you, most likely it's going to be colonoscopy. But there are other tests like the fecal test, fecal immunochemical test, or FIT, in which case some of them are being sold over the counter. You buy it and you send some feces to a lab, and they do some tests and tell you what it's doing. But that is not as great as colonoscopy. So if you have a choice, always opt for colonoscopy. And I think there's another one too, which is,
and with the FIT, it's what, every year.
Exactly.
Because
that's a good point to bring.
Yeah,
it's not
as great. So they really want to monitor you. They're going to do it frequently, because it's just the physics that they are checking. So Definitely. They will tend to do it more regularly.
That's a very good point. Because it's not as great, you have to do it every year. But colonoscopy, if you get it once and it's normal, you're going to be like good for 10 years. Unless in the future they change, because they keep changing.
Right.
Yeah, due to how increasing it has become. All right, and the last test is the flexible sigmoidoscopy, which is basically looking at some part of your colon to ensure that there are no what do you call it? No cancers growing. But again, it is not the best. The best one, I think, at least for me, is the colonoscopy, because they take the whole gut, the whole gut, right from your mouth all the way to the back, and they check it. They check it and they take out stuff as they go. That is the key. If they find something, they take it out. So it makes it even better that way. All right.
Yeah, and that is what repeated every 5 years. The flexible asthma.
Yes.
Okay, it's repeated every 5 years, which is less invasive as compared to the colonoscopy. So sometimes some people are not able to do the gold standard, or the gold standard is not available. That's what they'll go for. But in that case, you have to do it more frequently as compared to the colonoscopy.
Right. Yeah. So if you don't have access, then of course, like in some developing countries, colonoscopy may be something very hard to come by because of the cost. If you don't have access and you can do the fecal test, just do it. The most important thing is that you are doing something, and that's what is important here that we want to actually talk about. So unless you have anything else, we're going to go to the next screening, or the next cancer that we want to screen, and that I think is breast cancer, right? Yes, breast cancer. Breast cancers are also pretty common, very becoming very common, if it's not already common. Who needs the screening? It's a question that we have on screen. Who needs breast cancer screening?
So women between 40, starting 40 to I think 75, so you start the screening at the age of 40. So there is no way that you are 40, between 40 and 45. I think some literature says 45 if there is no family history. And if you have family history, some people can go as low as even 30 or 35 to be monitored. Depending on the results, the doctor may ask you to come every year, right? And if they find anything, they may ask you to come back to do ultrasound, and maybe from ultrasound, they'll still talk to you about if there is anything at all, how to go about it. But the most important thing is, like, you have to be screened at the age of 40 to 45, and maybe younger, 30 to 35, if you have family history.
Family history. Or if they found something, like you do breast self-exam. That is done every month, right? Monthly. So every month you yourself should feel your breast to see if everything is the same. If you see certain things that are appearing out of the blue, you didn't see it last month, and all of a sudden you're feeling something there, that may be something you have to, it's not maybe, you got to bring it to the doctors to check. And after that, you may actually be required to go in for a full detailed screening.
Right.
And if you are age 30 and you find that, then your screening begins earlier than the 40. So the 40 is an arbitrary number, again, depending on your risk. If there is a risk, especially if a mother or sister has it, 40 will be waiting too long.
Right.
You got to definitely go around your 30s, at least, even if not 30, by 32, 33, you should be seen and get things done. Some people have actually become very radical. If they know that in their family, almost all the women get it, they won't wait till the 30 or 40. They just go and they take out their breast, because it's very hereditary. And so just to avoid anything from happening to them, because they know their auntie had it, their mom had it, their sister has it. So obviously they are waiting in line.
The chance of getting it is very high.
Chance is very high.
Why would you wait?
So they will just go and take it out. And depending on how how comfortable you are with such an aggressive thing, it's doable. And these days there's plastic surgery. You can take care of it and get something done, and you protect yourself. So it's killing a lot of people. So definitely need to be monitored all the time.
And also, when you go to your OBGYN, before you even hit the age 40, they can also do the breast exam for you. And when they do it and they see anything suspicious or anything out of ordinary, they may request the mammogram for you. So it's not like you have to wait till 40. Monthly, you can examine it yourself. Then when you go to do your pap smear or you see your OBGYN, they also help examine your breast before you hit 40. Then 40, 45, definitely you have to get yourself checked.
40, 45, you must, whether or not you have a risk
or family history or nothing.
Around that time, you have to definitely do it. That you cannot wait any longer than that. So,
and one thing I want to put in is like when you go and the result is not that great, you still have to follow through. Some people will be like, oh, I don't trust. That's when I was talking about the second opinion too, or talk to somebody, to really give you an idea or explain it to you that if they find something in your breast, it doesn't mean you have cancer. It may be just a lump, and the lump may be just benign. There is nothing wrong with you. But if you ignore it and maybe there is something, then you have yourself to be blamed. So when you go, it's good to go get screened, but you also have to pay attention to the results. So when they start questioning what they are seeing, you don't want to brush it off. You really have to dig down, work with your doctor. If the doctor suggests ultrasound, you have to make the appointments and go and follow up. We know sometimes we are very busy, you work Monday through Friday, you don't have any day off to put the appointments in anywhere. You still have to make time because at the end of the day, it's your health and you have to pay attention to that.
Definitely, that's a very good point right there. All right, so let's move on to the next cancer, which I think it's in men, and it is the prostate cancer. Prostate cancer screening. Who needs prostate cancer screening? Who needs prostate cancer screening? If you are enjoying so far because you're a lady, don't leave because we are not done yet. You may want to listen for your uncle or your husband. All right. All right. So who needs prostate cancer screening? Yeah, prostate cancer is also very common, especially again if you are of African origin in terms of your race. It is becoming very rampant. And sadly, I think just today in the news, I heard former President Biden has been diagnosed with prostate cancer. Though he's of advanced age, it is still something that is possible. And as a matter of fact, the risk increases as you grow, especially after age 65. A lot of them get it. But still, if you are young, some young people are getting it. But the key again for this video, the main reason why we're doing this is to get you to screen and check so that you can catch it and stop it before it becomes too late. Because if you catch it early, you will kill it and you are going to survive. But if you don't catch it, that's when they find it and it's spread and it becomes like nothing that you can do. So the key is to get you to be looking and ensuring that if it is there, it will be taken care of before it gets worse. So 40s, 40 to 45.
Oh, just like breast cancer.
Just like a breast cancer, right? Men with high risk should discuss the screening options, around that age. Got it. What is high risk? Family history again. Uncle, father, your mother's brother, those people are close relatives that have it, or multiple people have had it in your family. Definitely make sure that you go screen. And as a matter of fact, it's become a standard of care here in the US. You don't even have to have those family history. Your doctor should be looking out to check because it's so common now. Should be, checking you for that. And the screenings are very simple.
And I think with the high risk African descent, right? If you're African American,
and those with family history should actually begin screening by age 45, you should already have the screening started. At 40, you begin to talk about it. Let your doctor know if you have family history. But latest by 45, if you are an African American man or any African descent, or African, I should say, you definitely need to have screening done. We're going to be talking about the screening in a little bit. And then after that, age 50 to 60, you have to do it continuously. Men at average risk of should also continue to do the screening. And as you grow, it depends on what your doctors say, the doctor's decision. So that is what we do. You have anything else to add to that?
No. So like as you age, right, the number also increases. So at age of 40, 45, I think you should be below a certain number. So as you age, the number may be affected. So when they do the tests, the level differ based on your age. Okay, so let's go to the next screen.
All right.
It tells you device it for you.
All right. So on the next screen, see if I can move mine. We are prostate cancer screening is what we are talking the details now, right? So we're going to be talking what they do. What kind of tests do we talk about here when it's prostate cancer? We're talking about PSA, which is a blood test, simple blood test. When you go for your annual visit and you are of age, you can ask your doctor, can I get my prostate or PSA test? And they will draw blood along with your diabetes check, same blood that they draw, we divide it for all those tests. And it measures what we call prostate specific antigen, which if elevated, then shows the concern for cancer coming. That being said, the fact that your PSA is elevated does not always mean you have prostate cancer. It's a marker. So when it's elevated, then they have to do more serious, more thorough check to see if a cancer is there. But you don't have to have cancer if it's elevated. It can elevate due to certain things, but if it's consistently high, then there should be a workup for more search to see if your prostate is growing any tumors and then be taken care of.
Yeah, and also if after the test, the doctor can also do the digital rectal exams, right? To feel your prostate and see if there is any abnormality in there. So sometimes the doctor will do that in addition to the PSA results.
If the PSA is elevated.
It's a little elevated. They will do the digital rectal exams just to be sure of where to go from there. So if that is abnormal, that's when they take the next level, the next step to make sure that you are healthy overall.
Definitely. And I think that the DRE or digital rectal exam is something that is done in the office, very simple exam. And so the PSA blood work, DRE, very simple. But many people are not seeing their doctors. If you're seeing your doctors every year and you're of age, you got to ask for at least for the PSA test. And if that doesn't look good, then they can proceed with the further studies to ensure that you are protected. All right, so we can move on to the next slide, right? All right, so the next thing that we're going to be talking about is what is a normal prostate value. We're just going to run through this. You don't need to know this, but just in case you have your lab work done and you don't understand the numbers, we're actually just going to leave it as this. And these numbers may also differ from institution to institution. Some offices may be more stringent, others may be more relaxed. But the main thing is that it was going to be around these numbers. So, and age 50 years, PSA should usually be around 2 nanograms per ml.
Less than, right?
Less than, yeah. And then 50 to 59, that's when you go to another level, which is about 3. And then 64. So as you grow, it increases. And so that is why the cancers are also more in older adults. After 65, more prostate cancers are diagnosed. But basically, it is something that looks like this. But we don't want to waste time there, so we're just going to go ahead and go to the next slide. We have a next slide there too. All right, so the next thing we're going to be talking about is cervical cancers. That's back to the woman, right? By the way, when we talk about breast cancers, men can also get breast cancers, but it's so low that there's no screening for men with breast cancers. So the women, don't feel bad. Men can get it too. All right. So now cervical cancers or cervical cancers, however you say it, what's the prevention and screening? And what do you want to say about that?
Yeah, so you have to understand what causes it. So we have the virus, the human papilloma virus, right? So that causes most of the cervical cancers, and normally it's transmitted through sexual contact. So if you're sexually active, it's something that you have to be tested for. So sometimes you go to your doctor, they will do the pap smear, and they will do the HPV test, just to make sure that you don't have the virus that can lead to cervical cancer.
Definitely. And then the age that we recommend, I was basically recommended that at age 21 to 65, that's when you begin regular screening. It could be earlier for teenagers who are sexually active. So if you have teenagers that started having sex earlier, then they could also be tested for HPV virus and potentially pap smear too, just to make sure that they are on the safer side. Because like she said, it's mainly transmitted through the HPV virus, which then causes cervical cancers. It's very common, and it's something that can be stopped. We'll show you one way that it can be actually prevented, apart from the screening. So we got to stick to the end when we come and talk about how to deal with some of these things. But definitely.
Yeah. And your pap smear is done every 3 years, right? And the HPV test is done every 5 years. Sometimes the doctors will do both around the same time. So if you go see your gynecologist, it's likely that they are going to do the pap smear and test for those diseases. And it's done every 3 years. So if you're a woman, you are married, you're sexually active, you have to make sure that you are up to date. If you haven't seen your gynecologist for a long time, it's something that you have to bring it up when you go. So that if it's more than 3 years, more than 5 years, it's something you can discuss with your doctor when you go to your doctor's office.
And yes, you said that if you're a woman and you're married, if you're not married, but you are sexually active, or you used to even be sexually active,
right?
But you are not sexually active now. The fact that you had, sex before, puts you into the category where you need to be screened, because all it takes is the virus from another person coming to you.
Yep.
Men are carriers, but men pass it around. So basically, you need to be tested, and that will be good. And then also, if you are a young person that's going to marry, you can always check first before you go into marriage to make sure that, especially for those who have not been sexually active, to make sure that you are taking care of yourself, and that will be good. So I think that is another thing that we can say about HPV. Cervical cancers. So we are moving forward. Now let's go to the testing. What happens when they test for cervical cancers? We're going to just rush through this. You either have negative, for a normal test means you are negative for what we call intraepithelial lesion or malignancy. Basically, you didn't find anything that you should be concerned about. And then this means that your HPV types were not detected. They also made sure that they didn't have that is when you have HPV tests. So you test for HPV, and then you also do the pap smear, right? So the normal is for the pap smear if there's no epithelial cells or lesions that we can talk about, or malignancy. And then if you do the HPV, just testing for the virus itself, normally means that they didn't find enough to warrant any further studies.
Yeah, so if it happens, it means that there is no immediate follow-up needed, right? You don't have to follow through. You just have to wait for the next time you're due, which is 3 years or 5 years, to do it again. But the point here that we want to stress is when they find something, when they find something, it's something, I'm sure they are going to sit you down and they'll have a plan on how to treat it. So if you get a call, after the screening, you don't have to ignore it. I don't know how many times I have to stress this, because sometimes some of us will have the results and we just push it aside. We don't want to discuss it with anybody. I hear some women don't even talk about it to their husbands. They keep all that to themselves. So it gets to the point that they don't have any control over. That's when it comes up. So if you're lucky enough to get screened, if you're lucky enough to have this service readily available for you, you have to use that service. And when there is something, you really have to bring it up, talk it out, find solution. There are lots of networks out there. There are groups of women with that issue online. Some doctors will give you help, support, other things, group of people, because when you hear such news, it's very scary. And sometimes you feel so helpless and you feel like there is no hope, or hope is lost and all that. There are services out there, there are activities out there, there are assurance out there. You just have to seek for it. And if you find it, and if it is detected early, definitely you are going to get a better outcome. Because you follow through early and they found it, and they will definitely make sure that you are treated and treated well, than to keep it to yourself and get to another stage or where it's too late to treat.
It's a very good point. I don't know why you would hide it from your husband.
But some people do.
Yeah, I know. It doesn't mean you're a bad girl. Whatever. All it takes is one person. The virus could have come from your husband himself.
Anyway.
So you don't have to. But the good news is that there's a way to prevent it. Apart from the screening and making sure that you catch it early and get treated, there's a way to also avoid it, especially if you are still at your younger ages. If you're still less than 45, you can even get it prevented. But we will talk about that as we move forward. So now, is there any other thing about that we have to do as far as HPV cervical cancer is concerned? If not, I think we can go to the next one, which is
action for prevention.
Action.
Right?
What are you going to do to take care of it so that you do prevent yourself? And so basically, we're going to go straight into how to prevent yourself or protect yourself against some of these diseases. The actions that you should take. We told you the first major action is to be screened. It's to be screened. Get checked. But then apart from being checked, what else can you do? What are some of the things that you can do so that you don't even get there? All right.
Yeah, so I think you talked about medical guidance, right? So if in order to prevent yourself from getting it, you have to discuss with your doctor your family history. If you need something, the doctors are not magicians. When you go, they cannot just look at your face and come up with diagnosis. So you have to share the information with them, whatever you know about your family. Sometimes they ask it, and because we don't want to, I don't know, sometimes we just don't want to share our family background with anybody, because we just want to bury it and throw it away. But you have to bring it up. So if you bring it up and the doctor feel like there is a concern, it's likely that they are going to order it sooner than later, because of your family history. But you have to bring it up. You have to talk about it. So when they come and ask you, do you have any family history? Don't be quick to say that no, there is none. But you have to do your homework. Your mom and dad may not have it, but what about your aunties and your uncles? And sometimes our culture sometimes mystify things so much that some of our family members will die and they will tell you that, oh, something killed them, but they don't really tell you what really caused it, So somebody may died of cancer, but because they say that it's like a bad word in the family. Nobody even brings it up, and you may be ignorant about. So action of prevention is like know your family history. It's not like you want to look for anything, just so that you get access to the screening earlier than somebody who has no family history.
Perfect. And then again, the action for prevention is to be screened. You cannot find it if you don't get checked. And the only way to get it out of your system is if you get checked and you find something, and then right away they take care of it before it becomes a big problem. So a regular screening is what we are saying. Very regular screening is what we are saying. So you got to stay updated on recommended screenings. Sometimes they change them. For example, they may say that, hey, now instead of every 10 years for colonoscopy, we are bringing it down to every 5 years. You got to follow the things. Ask your doctor, ask your care provider, APRs, ask your physician assistant. Say, hey, what am I due for? I like it when patients ask me, how many shots have I gotten? Am I missing any? There was this past week a patient that I took care of. I'm like, can I check to see if you're due for any shots? And they said, yes, check for me. But when I checked, they were all up to date. They had everything. Wow. That was the first person that I've seen that is up to date on everything. There was a couple actually, and I was so proud. And yet they were asking if there was something. But some people may be lacking, and when you ask them, they say, no, I don't have time for it. Or they have some superstition, that blows you off and say, I gotta go.
Don't even talk to me.
Don't even talk to me about it. Some people using faith. I mean, and there's a lady that said that, don't even mention that kind of thing. The man up there is taking care of me. And then I said, the man up there told me to ask you that you should get it. So no matter what, that's why God has given us all this knowledge so that we can also take care of ourselves. Yeah. And so definitely regular screening, we can't stress it enough. If your doctors are not ordering labs, they are not talking to you about colonoscopy, you're already 10, 40, you have no mammograms done, you have more than 40, 35, nobody has talked to you about it, or you're living in a place where they don't even have enough doctors, so they are rushing people out. They don't have the test even available. You got to be your own advocate. You got to say, where can I go to have this done? And sometimes the major hospitals will have the places to do them,
right?
But if you don't have the knowledge that you got to do it, nobody will ask you for it, and before you know, something has come up on you. So regular screening, basically, and then two things we're going to talk about from there also is vaccination. That's what I was saying. Vaccination, HPV, which leads to cervical cancers, can be stopped if you are vaccinated. The virus is the vaccine is very, very, I don't remember the exact percentage for prevention of cancers, but if you are vaccinated against this disease, most likely you will not get cervical cancer. And so from ages as soon as you become sexually active, we recommended it for even before teenage years, because most teenagers are sexually active, all the way to 45 years old. If you haven't had what we call Gardasil or HPV vaccine, then you definitely need to be looking out for it, because it will be to your good to protect yourself, whether or not you are sexually active now or you were sexually active in the past. You just need it. Some parents are hesitant because they say that if I give it to my child, it means I'm telling them that they can go and do all the bad stuff. No, that's not the reason. You are protecting them for the future. Even if they don't sleep around and they marry, their first husband can pass on to them the human papilloma virus. And at that point, what would you do? They still got the virus, they could still get the disease and get the cancer. So first thing you got to do is just share it. Just let them have it. Protect yourself if you haven't already gotten the vaccine. It's not that expensive. You can get it at any pharmacy, and especially in the US, of course. But I'm pretty sure in other places, if you go to your PCP or your care provider, you'll be able to show you where to get that vaccine, human papilloma virus vaccine. And then Gardasil is the brand name from US.
And another vaccine that is available to prevent liver cancer is the Hepatitis B. You know, it's readily available, so you have to make sure that you are up to date on your Hep B vaccine. You can walk up to any pharmacy and you can ask for it, and you'll be brought up to date. I think sometimes you have 2 shots. You know, you just get the first and the second one, then you are immune from that hepatitis. So we are encouraging you that you can get your vaccine readily available that can prevent liver cancer.
That's good. That's good. That's good. And as time goes on, more vaccines may show up for these cancers that are around. So you just have to always be asking and do your own due diligence. All right. And the last point on the prevention is lifestyle. Your lifestyle. Most cancers thrive well, or most risk for cancers include being of a heavy set. Being overweight predisposes you to several cancers. And so if you keep a healthy weight, that's one way of protecting yourself apart from the screening. So that is one. And then there are other things you could do. You know, exercise and quitting smoking. If you smoke and you quit, you are protecting yourself, your lungs, from getting into this problem. And if you exercise more regularly, studies also show that most of these cancers are far away from you. So stop these diseases before they even start. And we have said it: screening. Understand which tests you need to have and when. That's the key. When you need it and which one it is. You got to start conversations with your doctor and your family about your risk and what you need to do going forward. And I think that will be the last slide that we wanted to do about. So early detection through screening is your best defense against
action today.
Against anything, yeah. So take action and ensure that you are doing very good. So if you watched us, wherever you watched us from, and you enjoyed this video, why don't you do us a favor? Somebody just hit the thumbs up from YouTube. Do the thumbs up, subscribe, hit the bell button, and follow us. We will always come in your feed if you do that, so that we will share positive health information all the time when we meet. Usually on Sundays we come live, and hopefully you make time to follow and to be part of our community.